Hello, and welcome to the NYU Returns webinar, Keep Each Other Safe. Closed captioning is available for this webinar. My name is Darieli de la Cruz. I will be a resident assistant, or RA, this fall, and a junior at the Gallatin School of Individualized Study. With me today is Dr. Carlo Ciotoli, Associate Vice President, NYU Student Health, and Executive Director of the Student Health Center. Dr. Ciotoli, thank you for joining us. Can you take a moment to describe your office and your role?
Sure, and thank you everyone for getting on. As was said, I am the Associate Vice President for Student Health here at NYU, serve as the Executive Director of the Student Health Center, and I've been here as part of Student Health for 22 years, having helped the university with past pandemic planning as well. But really today, my role is that of lead of our COVID-19 prevention and response team here at the university, which is really all encompassing of the NYU community, not just students, but also faculty and staff as we think about a broad public health strategy for the semester ahead. Just a little background, I'm trained as an internist and pulmonologist, so a lot of my training and past experience has dealt with airborne disease, so again, has put me in a good position to help the university manage our planning for COVID-19.
Thank you so much, Dr. Ciotoli, and thank you all for joining again. I'd like to remind our viewers that we'll be starting off with some questions that were submitted in advance, and we will also be taking questions from the audience if time permits. If you have a question, please click the Q&A button below. We'd like to remind you that we will only be answering questions about public health today. So if anyone asks a question that would be better answered in a future webinar session, please know that we will pass those questions along to those panelists. Without further ado, let's get started. First question, what will testing and contact tracing look like on NYU's campus? Will students be tested routinely throughout the semester?
Great, so thank you for that question and for everyone who submitted questions. And I just want to start before I get into the specifics of testing, just to say that part of the planning process has been to ensure that we have multiple layers of interventions, knowing that no one is the perfect solution, that we can't rely on any one intervention, that we really do need to rely on all of our interventions to create that safe campus for the fall semester. And testing is one part or one layer of that. And as many of you know, there are many others, including face coverings, isolating when you're sick, the physical distancing, the hand washing, isolation and quarantine, a daily screener of symptoms that we have implemented already. So again, many things that we are doing to help protect the community for the fall semester as people come back. Specifically on testing, and I'm, at least for this session, going to focus primarily on student-related testing plans. Everyone on campus, faculty, students, and staff will all be tested at least once if they plan to be here on campus. And I know we'll have separate sessions for faculty, separate sessions for administrators, another one I think for other staff. So we can go into more detail in those sessions, but really focusing on the testing plan for students. It has a couple of components to it. Before students come back, before the semester starts, we are recommending but not mandating that students get tested in that short interval before they come back. Primarily because we don't want a student coming back and in the first days or weeks here getting sick, again, not being home with the ability to have support from others at home, the comfort of being home if you're sick, and introducing that into the community once you're here. So again, recommending it, but knowing that testing, the availability of testing throughout the country is very uneven. Some people can get tested readily, others can't. There's long wait times. So we've not mandated that component, but again, have strongly recommended people get tested before they come. The next part of testing is what we're calling sort of the upon arrival testing. And that is as students get to campus. And that actually applies whether you're in residence or not in residence, if you're coming from outside the tri-state area. Case counts are very low in the tri-state area, so the rules are somewhat different. But we're asking everyone coming from outside the tri-state area to be tested within 24 hours of their arrival on campus or to New York, again, if they're coming from outside the tri-state area. The university will arrange for that testing. We will have it on campus, and we're working with a third-party vendor to solidify the plans on that. The exact scheduling, the where, and that process will come out in subsequent communications. There should be an initial communication actually going out, if not today, certainly no later than tomorrow, that will lay out a lot of what we talk about today. So you'll have that with more detail. But again, some of the details around testing that won't be in that initial memo will be out in time for people to plan for that arrival testing, again, for students. Then there would be, for those, again, coming from outside the tri-state area, a second test somewhere 7 to 10 days after. And that is largely, just to share a little bit about the virus itself, it has what we call an incubation period, or the time from when you get exposed to when you get sick or become infectious, of somewhere, most people think, between maybe 4 to 14 days. So what we want to do is, even if you're negative when you get here, test you again so that we ensure that we capture that incubation period and are more reassured, and you can be more reassured that you're coming to campus starting the semester negative. So that would be the second phase. If you are from the tri-state area, case counts are low, you only need to get one test no more than 14 days prior to coming to campus. We'll talk about quarantine in a minute because it has a little bit of timing tied to the quarantine issue. The other phase of testing, or component of testing, that I know people want to know about is what happens on an ongoing basis, surveillance testing. And we plan to do a random sampling of the population, faculty, staff, and students each week to, one, help us identify people who might have what we call asymptomatic infection, people who are actually infected, but either have no symptoms at all or symptoms so mild they're not actually even paying attention, that they might be sick. And that will continue throughout the semester. And then finally, we would make sure that we are quickly testing what we would call our high-risk individuals, people more likely to actually be positive. And those would be people who have symptoms consistent with COVID, as well as people who might be close contacts. So that's sort of an overall overview of sort of the testing plan. Let me just see, there's a clarification. If they have to get tested and they're from a state like Vermont that's in the green zone, can you elaborate? So we are asking everyone to get tested once. Again, if you're coming from outside the tri-state, we're going to ask you to get tested again, even if it is a quote unquote green zone, only because there's been so much shifting of who has been the states, as you know, this week, even they added 3 more. So that is our plan. It is consistent with the state guidelines. So we are relying heavily on the state guidelines that actually ask or recommend that second testing for people outside the tri-state area. So some of that is just consistency with state guidelines, which is driving some of these testing protocols. Just a further clarification, how does testing and the time to get results factor into this plan? That's an excellent question. So the vendor that we contracted with, we will get 24-hour turnaround time on those tests, which is significantly better than what we're seeing nationally. So we would know really within a day of people moving in whether they are positive and negative. And I think that addresses those 2 questions. So we would know quickly upon moving in who's positive, who's negative, and then if someone were to be positive, they would actually be moved to a separate location for isolation if they are a residential student. So that is testing. Let me again just talk a little bit about quarantine, because some of the dates in our quarantine strategy also ties to state requirements, mandates, and timing. So we know that the prevalence, the amount of COVID-19 disease is different in different states. And as a result, the governor of New York, Andrew Cuomo, put out an executive order that requires people from states that have a certain prevalence of disease or a certain amount of disease in that state to be quarantined upon arrival in New York. That list is now up to 34 states, including also the District of Columbia and Puerto Rico. So it is a fair number of our students who would have to quarantine upon arrival. So what we're asking is all students, whether they are residential or non-residential, and who have either are coming from one of these states or spent any time in the last 14 days before their departure, to come to New York early. So for those in residence, they will move in early. There will be early move-in, and again, that will be outlined in the email that goes out. For even those who are living off campus, we are strongly recommending and really asking them to come in also on the 18th or 19th, which accomplishes two things. It allows the quarantine, one, it allows us to comply with the state mandate. Two, it allows students to complete the quarantine period before classes start. And three, will allow them to participate in the on-campus testing program, again, and get in those required tests during that period before the semester starts. Let me just pause there and address a couple of other things that have come up as it relates to testing. How will random testing be determined? What can be done to assure that there's no bias incidents related to the selection of student staff to be tested? It will be a truly random sampling. We won't know anything. We will try to make sure we are sampling across the community in an even way. I will say, just parenthetically now, to add something that we have done across all of our planning at the university, whether it has been the public health planning, the operational planning, the academic planning. We all have a liaison from the university's Office of Global Inclusion to ensure that we are sort of very conscious of these type of issues as we plan moving forward. So again, the random sampling will be just that, purely random. We may have specific cohorts that we identify based off of potential risk. We've not identified those groups yet, but just by nature, either of their academic program, of where they live, or other things that are generally accepted in the public health world as putting someone potentially at greater risk, we might test those individuals with greater frequency. But again, being very sensitive to issues of bias as we go out through this process. So I think that sort of at least touches on the quarantine issue, that we certainly will comply. The number of states continues to grow. The university has pushed up move-in dates to help with that. My understanding is for students in residence, they will also have 2 meals per day delivered during that quarantine period as well. So that's high-level testing. Let me then, I think the second part of the question was on contact tracing and what the plan is there. So just to talk a little bit about what contact tracing is, so we're sort of all operating from the same definition. So contact tracing is when we become aware of someone who is either a confirmed positive case, meaning lab confirmed, or what we would think is a highly presumptive case. So for example, if you're living together and someone in the living quarters is positive, and then a week later, the other person has almost identical symptoms, even before they get tested, we would probably consider that second person at least presumptively positive. So once we get those people identified, we then will reach out to people we perceive and assess as having any significant contact with those individuals in the prior amount of time where they may have been infectious. And that's usually at least 1 or 2 days before the time they became symptomatic. And then do an assessment of, were they a true close contact? And the CDC, the Centers for Disease Control, has a definition of close contact of being within 6 feet of someone for at least 15 minutes. So there is a discrete process of getting the history from the person who is ill and the active case, about what their whereabouts were in terms of where they were, and then reaching out to potential contacts and assessing, were they a quote unquote true contact or not. If we deem them to be a true contact at risk, then we would quarantine that individual as well. And at least for students in residence, the university has allocated a number of residences and rooms for the purpose of isolation and quarantine for those individuals. Now, normally quarantine is a function that the city takes on, and they have taken this on through a program called NYC Trace. What we also know is that contact tracing is most expeditious and efficient when done by people who know the community well. And it's quite critical that the contact tracing get initiated and really completed so that true contacts are identified generally within about 3 or 4 days. Because if any of those people turn to ultimately become an active case, you want them in quarantine before that happens. So there's a real need for this process to happen somewhat quickly. So we know the city does it, but what we felt was we could collaborate with and really complement the city's work by having our own team of contact tracers. So we've begun the process of putting our team together. They will go through the same training that pretty much all people doing contact tracing throughout the country are going to. One of the most common training modules is one developed by Johns Hopkins University, their School of Public Health. It's what the city uses for training, and we're asking all of our contact tracers to go through that as well. And we've had one call so far with the city, because again, we want to make sure the efforts are complementary and not in any way causing overlap or inefficiencies. I think that's it on contact tracing. I do want to say, touching on quarantine, I'm sure raised a whole set of questions about move-in and the specifics of all that, the dates, how are we going to do it. That will be addressed in the housing session, which I think that is tomorrow, but I think people can confirm that. It's up on the website as well. And just one other thing, I guess, on contact tracing is, weeks back when the city was first initiating this, people weren't answering the phone and the contact tracers were having a hard time getting information. What I would say to our community who's here, our students and everyone, frankly, that this is important to engage in. It is one of those things that we view as a responsibility as a community member, as part of keeping each other safe, that if someone calls about contact tracing, that you answer the questions honestly. And again, it just helps keep the entire community safe. So just to share that aspect of the work. So I think we touched on, you had asked about testing overall, I think contact tracing and sort of ongoing testing, which I think we've all touched on. So I think we've covered the first question.
Yes, thank you so much, Dr. Ciotoli, for that very informative and reassuring answer. And as Dr. Ciotoli did mention, the Residential Life Housing and Dining webinar will go on tomorrow at 11 a.m. So definitely keep your eye out for that. And just the second question now, which does actually have to do a little bit with quarantine. Dr. Ciotoli, if one person in a classroom tests positive, will everyone in that class have to quarantine?
So I get this question quite a bit. I think there is some concern that if someone is positive, does the whole class, the faculty member, everyone need to quarantine? And it is not an automatic. One of the things we talked about are layers of safety. The university has done a tremendous job trying to ensure that all the classrooms meet the physical distancing guidelines of 6 feet, so that all the seating is set up in a way that people are 6 feet apart. So the truth is, we think for the most part, there would not be close contact of anyone in sort of the normal classroom setting. Now, with that said, we would do the contact tracing. Maybe someone had a conversation with someone, masks off in the back of the classroom to go over something, an assignment, who knows, or in the hallway. I will say the university policy is that it's mask wearing, face covering all the time when inside. So that shouldn't happen. But again, that's why contact tracing is important for people to sort of find out whether that happened. But based off of what the actual risks are, we don't envision times where we would need to quarantine an entire class simply because one member of the class was positive. We'll go through our contact tracing procedures. If it turns out by whatever circumstance the whole class does need to quarantine, we would do that, but it is not an automatic. And frankly, I don't see the scenarios where that would happen with really any frequency.
Thank you. Thank you for that. The next question is, if a viable vaccine is developed or if cases are otherwise eradicated, is there a chance that all classes would return in person?
So, I think that is certainly the hope and what a lot of people hang on. And, certainly the vaccine news are among the news stories and the research I tend to follow most closely. What I will say is vaccine development is somewhat complicated. Even if a successful vaccine is developed, there are issues with distribution of the vaccine, people actually taking the vaccine and sort of the administration of vaccine broadly. And there's often a period of time that it takes for the vaccine to kick in. So certainly I think if one of two things happens, for whatever magical reason, the virus seems to disappear, right? Which, if only, or we have a viable vaccine, certainly at some point. Will that happen in the fall? Almost certainly not. Even the spring semester looks questionable just because of what we're seeing in terms of timeline of vaccine development. And again, I think one of the things that gives me optimism is there are dozens, if not hundreds of teams, research teams working on vaccine development, many of them partnered up with some of the large pharmaceutical companies, well supported. The federal government has provided monies to a lot of these teams for vaccine development. So there's been tremendous progress, I think faster progress than we've ever seen with any vaccine development before. So again, I think that gives me optimism. And certainly the early phase trials have all gone well, which is always great. So just so people know where we are with vaccine development now are in what we call phase 3 trials. So phase 1, they really give doses of the vaccine, different doses, make sure no one gets sick from it. It's almost a safety phase of vaccine development. Phase 2, they give the vaccine to small numbers of people, very small numbers of people. If you've read any of the studies, it can be sometimes as small as 8 or 10 people, 20. Again, still ensuring safety, but also checking to see, do people actually develop antibodies in enough amount that it looks like it could kill the virus and be effective. So those first 2 phases of trials for many of the research teams have advanced. And what's also encouraging is there have been very different approaches in vaccine development. So if it turns out one approach doesn't seem to be working, there is this big sort of span of or diversity of different types of the sort of approaches to vaccine development. So it still allows us to know that some may continue on. So now we're in phase 3, larger numbers, thousands of people getting vaccine. But now what we also want to see is not just that we draw their blood and we see antibodies, it's what we call sort of placebo controlled. So some people get real vaccine and some people in the study get not real vaccine. They get sort of saline. So then you compare, did the vaccine group actually get protected? And it takes some time because you want to see over weeks or even months, was the vaccine group protected? Did they end up getting COVID at a lower rate than the group that was your placebo group? So that will probably take us until the end of the calendar year before some of the results of those phase 3 trials come out. So again, I have tremendous optimism. The other thing I will say, and this is my own just historical personal bias, I started training, went to medical school, did my training back in the early to mid 80s. And at the time, it's when HIV and AIDS was first starting. So there has been HIV vaccine development going on for 40 years, and we still don't have a vaccine for HIV. And one of the people who was most involved with that vaccine development during the 80s and 90s was Anthony Fauci, who, as we know, was sort of out front with a lot of the COVID-19 work. Now, COVID-19 and HIV are very different viruses. One of the big advantages of COVID-19 from a vaccine development perspective is it doesn't mutate, which means it doesn't change what it looks like. So when we develop a vaccine based off of what it looks like today, it really hasn't changed much. So that gives us hope that when the vaccine development is done and we're actually ready to administer, it's going to be effective because the vaccine, because the virus hasn't changed. What else do we want to say about vaccine development? So am I optimistic that if it's developed, and then the other thing is just to say it, there is still a small but powerful group of people who do not want to be vaccinated, and there have been surveys out, and there is sort of a threshold amount of people that you need vaccinated to really protect the community. And for COVID-19, we don't quite know what that threshold level of, is it 60%, is it 70%, is it 80? So we'd have to ensure that we got up to that level of vaccine, which depends, again, how available is it, how easy is it for us to set up administration and distribution, and how willing people are to take it. So all to say, if the virus either just goes away or we have an effective vaccine that people take, yes, we can come back to all in-person classes at some point after that.
So much. That makes me pretty optimistic as well. So
I'm going to stay optimistic on that one.
Yes, awesome. It'd be great to be back in person classes. The next question would be, what should students do if they get sick?
Yep, good question. So one of the sort of slight dichotomies of sort of what we tell people is we certainly want to know if a student is sick. We also want them to stay home. And frankly, whether you get diagnosed with COVID or not, it's probably best to stay home anyway, because if you have a cold, flu, you also don't want to give that to someone else, because as we all know, COVID symptoms look like other upper respiratory symptoms. So, they make you feel miserable anyway. But again, it will just have more people needing to get tested, miss class. So, one is we certainly want people to stay home if they're not feeling well. Two, we do want them to reach out to us because we do still want to support students. And what we did in the spring, when everyone kind of just left all at once, we very quickly set up telehealth services so that students were actually able to have remote visits. And for most of these type of COVID-related issues, we can manage that over the phone. There can be an assessment of the symptoms, when they started, how severe they are, who they might have been around. And what we did learn from some surveying throughout the spring semester is overwhelmingly students felt that the telehealth services were as good, or for even a small percent, even better than having to come in. And certainly during a pandemic, we try to keep people out of congregate spaces, particularly sick people. So we're going to continue to rely on some of this remote telehealth work. So if a student is sick, we would ask that they stay home, reach out to us. The initial visit would be probably a telehealth visit. And then at that point, we could arrange either for testing, so they could get COVID tested, or depending on the nature of the symptoms, the severity of the symptoms, we'll still have the ability to see students in person and assess them face-to-face. So that is the basics, I think, if someone does get sick, during the semester.
Yeah, thank you. It's good to know. And speaking about the health center, does the NYU Health Insurance Plan cover all COVID-related illnesses?
Yeah, so the insurer that the university sort of has contracted with to provide some of our students with student health insurance is Wellfleet. And what they did back in the spring semester was to initially cover testing, but then they expanded to cover all treatment related to COVID with no cost sharing. That means there's no co-insurance, there's no co-pays, no deductibles, none of that. So for things that are truly COVID related, there is full coverage, at least for now. They've said until further notice. So students should be reassured that if they are on the Wellfleet plan, that coverage is in place.
Amazing. That is great.
You know, it's very reassuring, I think, to students, because I think sometimes people will forego getting care if they're concerned about costs. So I think, at least for now, that's been a very positive development on the insurance side.
Absolutely, I agree. And what is the Student Health Center doing to ensure that we don't exacerbate a disparate impact on the most vulnerable communities within NYU?
Great question. And, you know, one I think that we've certainly read about in terms of the disparate impact that COVID has had, and not just from a health perspective, but financial, societal. So it's an excellent question. And, you know, I think we've done actually a fair amount. And one, just to reiterate a point I made before, we have had liaisons from the Office of Global Inclusion involved in the planning, which allows us to be thoughtful at each step of the process to ensure that we are thinking about those issues along the way. And our colleagues have been wonderful in working with us on that planning. Certainly for students who might need specific accommodations, we have the Moses Center for Accessibility. And they've been working with students on a host of accommodation related issues. Some of it, the normal type of accommodation issues that we always had as it relates to housing, some traditional academic accommodation issues, but some new accommodation issues, perhaps related to remote learning. So we've worked closely with the Moses Center on ensuring that we are accommodating students who have specific issues that need some type of accommodation. We also, I think, as I mentioned before, one of the things that I think helps ensure that we are addressing or thinking about our most vulnerable populations is to make access as easy as possible. And that really has been, I think, a hallmark of health center planning for years, is to ensure easy access. And again, I think our model of telehealth does that. And we have been working diligently in the last couple of weeks to try to ensure that we can overcome all regulatory licensing issues so that if a student needs our support wherever they are, whether they're here on campus or they decided and chose to stay home, that we can support them with services, formal clinical services, or at least help manage them with services that are available to them locally. We, as was alluded to earlier, are offering testing for free throughout the semester, both in that arrival time, as part of the ongoing surveillance, as part of the symptomatic testing. All of that testing will be free. So again, there should be no barriers for students to come in and get tested. We also, we talked a little bit about isolation and quarantine. And one of the things that we're doing, as we said before, is not only putting in a team of contact tracers, but also a team to sort of care manage people who are in isolation and quarantine. So certainly we'll ask about symptoms and have mechanisms to assess, whether people are, if they were sick, are they getting better? If they weren't sick, are they developing symptoms? But part of that care management or case management will also be to ask about basic needs. So that we're ensuring that any student's basic needs across the spectrum, whether it's academic, financial, health, mental health, are all getting met. So that would be part of what we do as well. We have always had and encouraged active engagement if something is not perceived right by a student. So we routinely push out patient satisfaction surveys. We have a mechanism on our website to submit feedback. We have a patient advocate that students can go to and share any experience that they want to give the health center feedback on. So those are certainly all available as well. And I would sort of lastly say that so much of this has come to light with hard data. You know, we really saw who was being impacted. And one of the things that we'll do across all the data we'll collect is ensure that we look for that. Are there disparate impacts here among our students so that we can address them? Because sometimes they're the obvious ones that we anticipate, but sometimes we're surprised at where we're seeing disparate impact or inequities in health and well-being. So we just want to be attuned to that and make sure in our data collection that we're taking all of that into account so that we can be really proactive in trying to address that.
Thank you. Thank you so much for that, Dr. Ciotoli. And it looks like that is all the time we have for now. However, I did want to ask Dr. Ciotoli if you have any final thoughts that you'd like to share with the group before I wrap up and give some last minute reminders and notes.
Sure. I'm just going to, I think there was a request for some clarification on one or two points. So let me do that. And just to go back on what quarantine means, I'll make the distinction between isolation and quarantine, and then just talk about testing. So isolation is what happens to someone who is actually sick. And that person basically needs to be away from everyone else. So that's isolation. Quarantine is where we find out that someone was a close contact. So that often happens within a family, where one spouse might get sick and then the other would become a close contact because they're generally not always wearing face coverings within an apartment, right, or within a house. But if we then determine that someone who was exposed to someone who was positive, we think is a true close contact, they need to then go into quarantine, which means really almost the same thing as isolation. Separate bedroom, ideally separate bathroom, but if not, you know, you're not in the bathroom at the same time and you're sort of wiping down fixtures in between, having someone bring meals to the building, not being out in public. So I think one of the things that we want to reiterate, even in that quarantine where people, when students are coming initially, you know, unfortunately, you're pretty much going to be stuck in your residence hall for that 2-week period. Yes, the university will bring you meals, but you really can't leave. You know, you can't go out shopping. You can't go out, you know, for a quick bite at a restaurant. You know, you can't even go to religious services for people who want to engage and go to religious services. So the requirements are somewhat strict, laid out by the state. So again, it is a little bit challenging, but really what we have to do in these times. And then just a clarification on the testing front, anyone who will be on campus. So if you're in residence, if you plan to go to classes, if you plan to teach a class, if you plan to be in an academic building, an administrative building. So, you know, there might be a scenario where you live off campus, you've got all remote classes, but you want to go to the library, you want to go to Kimmel, you would need to get tested, you would need to be quarantined. So everyone who has any plans to access a building on campus will need to be tested, again, at least once. And then we've got that sort of split between if you come from the tri-state area, that one test is enough. If you're coming from outside the tri-state area, you need that initial test and then a subsequent test later on. And again, some of this will be outlined in a little bit more detail in memos and emails that will be going out, again, over the next day or two at the latest.
Yes, thank you, Dr. Ciotoli. I'd like to thank you for joining us today, and thank you also to everyone who was able to log on and participate. This webinar will be posted on the NYU Returns website so that anyone who missed it can view it. A full transcript will also be available, and many of the questions will be answered during the faculty, administrator, and staff-related sessions that will happen next week. as well as tomorrow in the Housing, Residential Life, and Dining session at 11 a.m. When you go to the NYU Returns website, I encourage you to take a moment to check out previous webinars that have already been posted. And please continue to check the NYU Returns website for most up-to-date information about the fall 2020 semester. Everyone stay safe and enjoy the rest of your summer. Thank you.
Thank you, everyone. Bye-bye.
Bye.